In Canada, the most susceptible population to diseases and infections is the Inuit population. The Respiratory Syncytial Virus is the leading cause of lower respiratory tract infection in children, which can lead to bronchiolitis and pneumonia, requiring hospitalization for infants. Unfortunately, the Inuit region does not have adequate medical facilities or supplies for hospitalization, nor does this virus have a vaccine, so the government has to fund trips for the affected Inuit children and their families to fly down south for medical care. This is a big cost for the government and a hassle for the Inuits. I looked at the potential effects of curcumin on RSV replication and RSV induced cytokine production, as curcumin has been shown to be anti-inflammatory and antiviral, having been found to reduce viral replication in influenza, coxsackie, and adenovirus. My hypotheses were firstly that curcumin would inhibit RSV replication, and secondly that curcumin will reduce RSV-induced cytokine production. The cytokines I focused on were IL-12, 23, and 27, as work on IL-23 and 27 have been relatively recent and no work has been done in this context. IL-12 and 23 are pro-inflammatory, while IL-27 mediates the pro- and anti-inflammatory effects. The experimental approach taken started by treating the human lung epithelial BAS2B cells and monocyte cells THP1 cell lines with the appropriate concentration of curcumin RSV or LPS, the positive control for cytokine induction. After incubation for 3 to 5 days, the supernatant was collected. A plaque assay was performed for the enumeration of infectious particles, and ELISAs were conducted to measure the amount and types of cytokines found. I found that curcumin does not affect the replication of RSV in THP1 or BAS2B cells. However, I observed that curcumin slightly reduced IL-12 production at 20 micromolar. IL-27 was shown to be significantly reduced by curcumin at 20 micromolars. The reduction of IL-27 may not necessarily be beneficial. However, curcumin could still downregulate other cytokines to inhibit early inflammation. This is a novel finding. If further investigations show curcumin reducing or raising certain cytokine production in a positive way, the effect will result in reduced inflammation, swelling, and thus a reduced amount of symptoms in the affected patient. This would help both the Inuits and our government.